I don't have a delusion that the government is out to get me, but I think they could do more to make it easier for people to get access to help. I don't know, that's probably not what the question is. Like, I don't think there's a conspiracy. I just think for some reason, no one spent the money yet that would make a difference.
Mental health has been seen as a taboo topic for thousands of years now, largely due to people's ignorance. People thought that if you had mental health issues that you were possessed by demons, and if you prayed enough, you'd be able to cure them, or that you were contagious and so better to lock you up away from the rest of the society. That way we didn't catch whatever you had. Or that you were just incurable, or only curable by drilling a hole into your head and turning you into a zombie. It is largely due to knowledge being spread around this topic now that there is less ignorance and less stigma around this. And I say largely because unfortunately there is still so much stigma, fear, and stereotypes around certain mental health diagnoses, and schizophrenia probably being the biggest of these. And so I realized that I had a great opportunity with this channel to be able to share some of that education and spread some of that knowledge to hopefully remove some of that ignorance that we see. And for the very few of you that'll watch all the way through to the end of this video, my hope is that you can look at the diagnosis and people that live daily with this diagnosis in a different light. And for those of you who do end up watching the video and enjoying it, please, please, please let me know in the comments. It really helps me to know what videos you all like to see and what you don't. And I'm thinking of doing a series based on mental health diagnoses, more stigmatized mental health diagnoses. And I already have some Netflix shows and films in mind for things like dissociative diagnoses, especially dissociative identity disorder, for instance, or formerly known as multiple personality disorder. And so let me know if that's something that sounds interesting to you all. Enough intro, now let's jump in. Now this is going to be a lot of information for you all, but the great thing about YouTube is that you can save this video, come back to it, and watch it anytime that you like. So don't feel pressure or stress to have to understand and take in all this information in this first watch. Today I'll be showing clips and using examples from the show titled You Can't Ask That. And you can find it on Netflix, as with all the other shows and films that I review on this channel. So this is an Australian show that was actually airing on TV in Australia. And what it's about, it's meant to highlight certain marginalized communities, and it brings on people that are part of those communities to ask them questions and to hopefully try to get rid of some harmful stereotypes that are out there. With the episodes that you can find on Netflix, they talk about things like people who identify in the Muslim faith, people who are sex workers, those experiencing homelessness, and for the purposes of this video today, those with the diagnoses of schizophrenia. The first thing to keep in mind about schizophrenia is that not all people who have psychotic symptoms will be diagnosed with schizophrenia. In the Diagnostic and Statistical Manual of Mental Disorders, which mental health professionals in the US use to diagnose mental health disorders, schizophrenia is actually under the umbrella of schizophrenia spectrum and other psychotic disorders. That's because schizophrenia is on a spectrum, just like how autism and ADHD change to be seen as being on a spectrum. And so somebody who has psychotic symptoms can be presenting with a lot of different disorders, actually, that they could be diagnosed with. So a couple of these are schizotypal personality disorder, delusional disorder, brief psychotic disorder, schizophreniform, schizophrenia, schizoaffective disorder, and some kind of psychotic disorder that could be due to a certain substance or some kind of medical condition. Oh, and don't even get me started on people who can experience psychosis as a part of another mental health disorder like depression or PTSD. I won't have time to go into depth on any of the other diagnoses in this video, but some of the differences are the length and time that people might have symptoms compared to those who'd be diagnosed with schizophrenia, just having delusions and no other symptoms, or something like having mood disorders or mood symptoms in addition to psychosis. So for instance, having bipolar disorder, but also experiencing psychosis. So like I said, I will only be talking about schizophrenia in this video, although one of the women from the show was actually diagnosed with schizoaffective disorder. So when I'm talking about how you'd get diagnosed and how many people have it and all of that, I'm only talking about schizophrenia. Got it? Okay, great. So let's start with how many people have this diagnosis. So in 2022, the World Health Organization estimated that about 0.32% of people globally, or about 24 million people, had the diagnosis. In the US, where most of you are watching this from, there was a study done known as the Mental and Substance Use Prevalence Study. And in that study, this was done in 2023, they estimated that about 1.8% of adults ages 18 through 65, so about 3.2 million, had the diagnosis. However, those numbers are definitely higher for people in the US, as you can have a schizophrenia diagnosis before the age of 18. And the age at which you get the diagnosis, that does differ by gender, or sex rather. So what we see is that biological men usually get the diagnosis or usually start to experience symptoms around their late teens to mid 20s, and then biological women experience symptoms in their mid 20s to early 30s. The difference in age at which a person can first start to experience these symptoms puts men and women at a very different trajectory in life. One of the men in the show talks explicitly about this. For men, a lot of studies show that when they finally go into remission, a lot of them might not have a degree, a college degree, or a professional degree to fall back on, which can make it a lot harder for them to find a job and earn enough to make a living. That's because, not always, but very commonly, men will go off to college, have their first psychotic break, their friends and family have no clue what's going on, they themselves definitely have no clue what's going on, they don't get treatment, and it worsens to the point of dropping out. And so I don't say this to scare you, but if you or somebody that you know is predisposed to schizophrenia, and I'll talk about some of the factors that can go into that soon, please, 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 especially in the late teens, be on the lookout. Yes, you're technically an adult at age 18, but I know, at least for me, I was still relying on my parents, my family, for so many things. I can only imagine at this age experiencing your first psychotic break and just having absolutely no clue what to do. Imagine how scary that experience must be. Another aspect in terms of a different trajectory with men is that because of the younger age that they get symptoms, that they are less likely to be partnered, so to be in a romantic relationship, and romantic relationships can provide some kind of support, especially during what is a tough time experiencing these symptoms. So it's not impossible. Plenty of men with psychosis are married, but because of when they experience symptoms, this timeline might be pushed back for them, and for some, completely halted. So if you had a vision of being married and being a husband and being a father, imagine the difficulty of of this timeline being pushed back, and or having to accept maybe not being able to be one at all.
Yeah, I was married at the time, but after the doctors finished with everything, my marriage finished. That was pretty hard for me to cope because I married the woman that I wanted to grow old with and sort of have a perfect world. Within 48 hours, that world had disappeared.
Things are pretty different for women. So like I said, for women, they start to experience symptoms in their mid-20s to early 30s. And so because of that, they usually do have some kind of professional degree or some kind of college degree to fall back on when they go into remission. And statistically as well, they are more likely to be married. So like I was saying before, that can lead to a lot of support that they can have, or that could lead to a lot of issues within their marital relationship when maybe both partners don't know what's going on and there's just a lot of conflict that can happen. These women also may have kids, and imagine the overwhelming reality of trying to raise a child or multiple children when it feels like you're losing control of your own mind. On top of that, this is a pretty big change later in life. I mean, in your 20s, that is a tough time. It is full of a lot of big decisions, a lot of confusion, and finally in your 30s, you're maybe settling down in your career, maybe you're in a relationship, and you just have a much clearer sense of yourself. You're more confident in yourself. Imagine that all changing one day. I mean, I'll turn 30 years old in May, and I can only imagine everything changing and me being given this diagnosis when I'm finally at a point where I'm starting to feel comfortable in life and like I'm truly living life.
I don't know. It's sad because I can remember when I wasn't sick. I can remember when I wasn't always in pain. I was just a person.
At least for myself, I can take comfort in the fact that I don't really have a lot of factors that predispose me to getting a diagnosis of schizophrenia, but not everybody is that lucky. And so, what are some of those factors? So before we jump in and look at those, I want to caution you against what's known as the psychology student's paradox. So what this is that, psychology students, so since we take a lot of courses that have to do with diagnoses and we're self-reflecting all the time, we can get into the pattern of self-diagnosing. While this might be helpful in some cases, you are not a professional. And even me as a professional, I'm not 100% unbiased when it comes to myself. So even if you think some of these symptoms sound true to you, it does not mean that you have some kind of psychotic disorders. And if you really do, if you really think you might, please go to a professional to get diagnosed. Many mental health disorders share symptoms that can make it look like you have one thing when it's really being caused by something else. And proper diagnosis is key, especially if it's for something where you need to take medications. Okay. I'm off my soapbox now. Let's jump in. As is the case with any mental health disorder, there are genetic and environmental factors that can predispose us to getting a diagnosis, to developing this condition. And the best way to figure out the impacts of which factors is by looking at twins. Twins share the same DNA. So if something is highly hereditable, we should see typically both diagnosed with it. And if they are not, then that lets us know that there are some other factors at play. A man on the show mentions that he's a twin, but his twin wasn't diagnosed with schizophrenia. And he was saying that he has no idea why. And I can understand the shock because schizophrenia is one of the most genetic disorders that there are out there, meaning that it is highly hereditary. If a parent or a sibling that's not a twin has schizophrenia, you are 10% more likely to get the diagnosis yourself. And if a fraternal twin has it, this jumps up to 15 to 20%. However, for identical or monozygotic twins, taking you back to biology with that one, this jumps up all the way to 50%. So the flip of a coin. From what I can tell by looking through his Instagram, it looks like he has an identical twin. So like I said, the odds are really 50-50 there of them getting the diagnosis, but genetics isn't everything. There's a show on HBO Max that's called 6 Schizophrenic Brothers, where it looks through the lives of the Galvin family, and they have 12 kids, and out of the 12, 6 of them have schizophrenia, and the other 6 don't. If it was all just based on genetics, then all 12 of them would have it. So an environmental factor could be any complications or things that happen in utero while the mother is pregnant with the child. So that could be a mother developing diabetes while she's pregnant, or smoking, or any number of things that can occur during pregnancy. If there's no kind of complications or anything out of the ordinary that happens during pregnancy, then that's where we would look at kind of brain factors that might be going on. One of the main, if not the main, hormone indicated in schizophrenia is dopamine. An excess of dopamine in the brain can result in some psychotic symptoms that you might see in folks that have schizophrenia. But before discussing that, we'll talk about things that we can introduce in our body that can increase this dopamine and throw off our system. So for instance, if we take drugs. Some people just have structural abnormalities in the brain, so decreased gray matter, issues with myelination, larger ventricles, a lot of fancy terminology, I know, but structural abnormalities, including issues with the dopamine system. And I highlight the structural abnormalities because there can be what's known as a substance-induced psychosis. I talked about earlier when I talked about the many different diagnoses under that schizophrenia spectrum umbrella. And so with folks that have a substance-induced psychosis, what we see is that when they take some kind of substance that increases their dopamine, while they are on it, they experience these psychotic symptoms. But once that drug leaves their system, basically once the dopamine leaves their system, they don't have those experiences anymore. So if it was just based on high dopamine in the bloodstream, then you would have long-lasting psychosis if you introduce some kind of drug in your body. But we don't. So that highlights the idea of some kind of structural abnormality that could be going on. And speaking of drugs, they play a role. Now, you probably think I'm going to mention something like hallucinogens or acid, LSD, mushrooms, all of those. But actually, cannabis is the most commonly connected to schizophrenia. So much so that in this show, they only talk about that drug and nothing else. Now, in this clip, some of the folks are laughing about the idea that smoking too much weed led to psychosis, which for some people, it doesn't. However, for some, it definitely can. So some studies have shown that cannabis use during adolescence, especially high use, can increase the risk of developing schizophrenia by up to 3 times. And so, if you are predisposed to schizophrenia in any way, just know that consuming any kind of cannabis is putting you at risk. And I want to take a minute here to talk about another huge negative consequence of cannabis use. I feel like globally, the potential negative effects of prolonged cannabis use is really underestimated. I mean, we see that Snoop Dogg has smoked like a chimney for years and years and years, and he's fine, so there's no issue. There's no negatives. You can't get addicted to it. Everything's fine. Well, that's not really the case for some people. There's something known as cannabis hyperemesis syndrome. I've seen this in at least 2 people where I work now, and with the widespread legalization of cannabis, we're likely going to see more people with this. What this is that when people ingest cannabis that have this, they have extreme stomach pain, nausea, vomiting, and or retching, which is the act, kind of the physical act of like you're going to vomit without the product of it. And to make it worse, this lasts anywhere from 24 to 48 hours. Some people, it gets so bad, the pain, that they even scream while they're vomiting. It is not pleasant at all. And knowledge of this has only really come to light in the last decade or so we're not exactly 100% sure of what causes it, but some of what we've seen is that for people who have been smoking longer, so for at least around 10 to 12 years, especially if you started earlier, like in your adolescence, are at higher risk of developing this. And these people are at higher risks even if you were just smoking or using cannabis once a week, which is not incredibly uncommon for people who do use some kind of cannabis products. And then all the consequences that go with consistent vomiting that we see in people with, say, eating disorders, for instance, where that's a feature of it, can be seen here. So things like severe dehydration, malnutrition, weight loss, tooth decay, injury to your esophagus, and many, many more. And it's not to say I'm anti-weed. I'm really not. It's just, as a psychologist that works in substance abuse treatment, it really irks me whenever anybody undervalues the potential negative consequences of any drug, period. Okay, that's soapbox number 2. I am off of my second one, and I promise that'll be the last one in this video. So going back to environmental factors, substance use can be a big one, but generally it's some kind of stressor that happens. So like I mentioned for men, they can go off to college, and going off to college can be very fun for any of you who have gone, but it can also be extremely stressful. Just that transition and the schoolwork and just being there can be extremely stressful. And then for women in their 20s, a lot of women actually can develop psychosis before, during, or after childbirth. And I don't think I have to explain why that can be a stressful experience. So, genetics, brain vulnerabilities, and some kind of stress is usually the recipe for getting a diagnosis. Speaking of which, I'm finally going to talk about what goes into getting a schizophrenia diagnosis. And remember what I said on soapbox number 1 about the psychology student paradox? Yeah, don't do that. Okay, so there are 5 main symptoms to getting a schizophrenia diagnosis, and you need to have 2 out of the 5, and at least 1 out of the 2 has to be one of the first 3. Did I lose you? The 5 symptoms are delusions, hallucinations, disorganized thinking or speech, grossly disorganized behavior like catatonic behavior, and negative symptoms. So you need 2 of those at least, and one of them has to be either delusions, hallucinations, or the disorganized thinking and speech. And you have to have those symptoms for majority of a 1-month period, and you have to show some kind of symptoms still up to 6 months. If it's less than that, then it would be a different one of the disorders that we talked about earlier that you'd be diagnosed with. Let's do a deep dive into these 5 symptoms, starting with delusions. Delusions are false beliefs that exist despite evidence to the contrary, meaning you trying to prove to a person that they are delusional will not work. Okay, so delusions can be either bizarre or non-bizarre in content. So bizarre delusions are clearly impossible or implausible beliefs, while non-bizarre that they're possible, but they're unlikely to be happening, and there's a lot of evidence usually that shows that at least at that moment it's not happening. So examples of non-bizarre delusions are things like persecutory delusions, where you believe that you're being spied on or somebody's out to harm you. So either the government is following you or that somebody's trying to poison you, for instance. There's erotomanic delusions, which is where you believe that people are, or a specific person usually is in love with you. You can have jealous delusions, where people might believe that their partner is cheating, being unfaithful in some way. There are somatic delusions, where you can believe that you have some kind of medical illness or diagnosis, even when there are tests and things saying the contrary, that you don't have this. And then there are grandiose delusions, and or also known as delusions of grandeur. And what this is where we overestimate our wealth, our abilities, and our power to some degree. So like there was a meme going around last year in which it was about something like 50% or over 50% of men thought that they truly thought, and a lot truly think, they could safely land a plane in an emergency situation. You're delusional, hun. So obviously all the things that I listed are possible, but for these folks that have these delusions, there's no clear evidence at the moment to be backing that up. Now comes the bizarre delusions, which again, these are things that are impossible or completely implausible. Some of these are ideas of reference, so thoughts that external events, random events that are happening in the world are somehow related to you. So maybe this news anchor, that they're talking directly to me. There is thoughts broadcasting, where just as it sounds, you think your thoughts are being broadcast for the world to hear. There's thought insertion, where, as it sounds too, where you think that people are inserting thoughts into your head. And then 2 of these come back from the non-bizarre delusions, so the erotomanic delusions, and this, though, of this form for the bizarre, is where you fully believe that a specific celebrity is in love with you or you are good friends with this celebrity.
German postal worker thought he knew my very good friend Madonna. He was suffering from something called erotomania, sweetheart. It's a delusion.
Well, you're just cross with me.
Where you think you know someone, you simply don't.
And grandiose delusions again, and or the delusions of grandeur, where you think that you are somebody of really great importance. So maybe you're the reincarnation of Steve Jobs, or you're a superhero. And then there's the nihilistic delusions, where you have thoughts about the world ending, which that could be kind of non-bizarre, but the bizarre part of it is also thinking that you're dead. Okay. Those were delusions. Now what about hallucinations? Hallucinations are perceiving things that are not real as if they are. So there's no external stimuli. Nothing's there, but you think that something is. That is very different from what's known as an illusion. So an illusion is a misperception of a stimuli that is actually there, that actually exists. So if you have your hoodie hanging on the door frame and you accidentally mistake it for a person, that would be an illusion because the hoodie was actually there. You just thought it was something else. Or if you think you saw your shower curtain moving, that would be an illusion because the shower curtain's there, but you just perceived something falsely happening about it. So that is not a hallucination. Now, hallucinations can occur with any of our 5 senses, but auditory hallucinations, so hearing things that aren't really there, so like voices or music, that is the most common, followed by visual hallucinations, which those are the 2 that we only ever really hear about, but like I said, it can happen along any of your 5 senses. So hallucinations and delusions are 2 of the most popular of what we would term positive symptoms of schizophrenia. So think about positive in terms of excess. So these things are in addition to normal experiences, right? So you are hearing something, if it's auditory delusions, in addition to what's actually there, or you are believing something that is in addition to what is truly happening. So it's this excess. The other positive symptoms that you could be experiencing that could lead to a diagnosis are the disorganized thoughts and speech and the kind of abnormal motor behavior or some kind of abnormal movement in some way. Disorganized thinking and speech is just that. People have difficulty with organizing their thoughts and then expressing them in a coherent manner. So they might jumble up their words a lot or jump from topic to topic in a way that doesn't really clearly make sense. And the issue is, with the hallucinations and delusions and also this, people don't realize that there's an issue. They don't realize this is happening. So I've often worked with people who have schizoaffective disorder, usually, and it is sometimes virtually impossible, or I would say most times virtually impossible, to have conversations with these people when they're exhibiting these symptoms. And so I had a recent client actually to where he was jumping from topic to topic in a way that did not make any clear sense. And he would often say things like, oh, you know, blah, 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 as if I was following him when I was not at all. Then the last positive symptom is a form of abnormal motor behavior. So this could be bizarre facial expressions like potential facial tics or bizarre movements like rocking or pacing. And this is where catatonia or catatonia, however you say it, comes into play. I know I'm really dusting off the Psych 101 terms today. So before I describe what it is, know that catatonia is what is described as a specifier in the DSM. So specifiers can describe a couple things. So they can describe the severity of the diagnosis, they can describe the course of it, so whether it's just one time that it happens, whether it happens frequently, or maybe whether the person's in remission, that they don't actually present with these symptoms present day, but they have in past. And specifiers can give some information just about some special features that a person has in relation to their diagnosis. Now, with some diagnoses, with these specifiers, you can have just one of them, a few of them, or you can have them all. So for instance, with addictive disorders, so in terms of like the substance use addiction, so they have mainly two specifiers, so severity and if they're in remission or not. So you can get diagnosed with a substance use disorder and you would specify if it's mild, moderate, or severe. And then you can also specify if the person is in remission or not. And the DSM qualifies being in remission as at least 3 months. Anything at 3 months and past that is considered remission. However, with depression, you can have them all. For depression, we'll specify the severity. We'll also specify the course. So if it was just one episode of depression or if it's recurrent. And then we'll specify other symptoms that might be occurring. So whether it's seasonal, if it happened in relation to pregnancy, or if it might have some kind of atypical feature. So for instance, if the person has increased appetite, or if their mood actually does improve when something positive happens versus what we often see, which is a consistent low mood for people with depression. So catatonia is one of these, and it's made up of multiple different symptoms that could occur that affect movement, but also behavior and cognition. So there are 12 different symptoms. You only need 3 to get this specifier, and a few of these things are things like mimicking a person's speech or a person's movement, not talking at all. It could be kind of like if a person were to position your body in a certain way, your body just stays like that, even if it's very unnatural or strange. So if they position you leaning kind of almost against gravity, your body would just stay that way. And agitation, amongst other things. Those are the positive symptoms, meaning excess. And if you remember from way back earlier in this video, when I talked about the 5 symptoms that you needed to be diagnosed or that comprised a diagnosis of schizophrenia, one of these was negative symptoms. And you guessed it, if positive symptoms means excess in terms of an addition to normal experiences, negative symptoms is kind of a subtraction, so removal, so lessening of things that are normal. And we can often remember these by thinking of the A's. So the different A's that can go into this is alogia, so that is a kind of diminished or impoverished speech. So some people may have, they may just say a few words or a few very short sentences, so difficulties with speech. Avolition, which is just lack of motivation to do anything. Anhedonia, which is a lack of interest or pleasure in doing things that maybe used to be pleasurable for you. If that sounds familiar when I'm saying that, it's because that's also a symptom of depression as well, which is why it's so important to get diagnosed by a provider, because like I said, a lot of symptoms can go with a lot of different disorders. So anhedonia is one. Asociality, so think of that as being asocial. So withdrawing from social situations, really not interested in forming those social bonds, so not really social. And then a big one of the A's is affect, so kind of how your face presents, basically. So people who have negative symptoms when it comes to affect, it's just completely flat. And so when something happens, there's kind of no reactions, or it can be very restricted. So when something might happen and somebody can get really, really happy or really, really sad, it's like lessened in intensity. And for the affect too, it can also not match the situation. So maybe it's normal in a sense, but it is not appropriate for what the situation is. So maybe they're smiling when they're talking about incredibly intense trauma. And then other big negative symptoms that don't really fall into the A's are things like not caring for yourself, so self-care, so things like your hygiene, and or not being able to do kind of simple daily tasks. So if you got to this point of the video, the overwhelming emotion that you should be having, or at least I hope that you're having, is that of sadness and hopefully empathy. These experiences are not pleasant for these folks. It's incredibly scary, incredibly confusing, and incredibly isolating. While you might see some of these symptoms and fear for your life being around somebody that's in active psychosis, they are much more likely to be in danger. People with schizophrenia are much more likely to be the victims of violent crimes rather than the perpetrators. And they are much more scared of their own minds than you are of theirs. Just think about, take a moment to just think about how incredibly sad that is. And going back to what I said with the crimes, according to a lot of research, only around 10 to at max 15% of people with schizophrenia will commit a violent crime in their lifetime. In their lifetime. So that could be 50, 60, or 70 years of having a diagnosis. How many of you, when you were in school, got into fights with people? How many times might you have slapped a cheating ex? Or gosh, the majority of mass shooters in our country don't even have a mental health diagnosis. And yet we're demonizing the 10% of people with schizophrenia that might commit violent acts. The hallucinations that people can experience with schizophrenia can, and unfortunately often do, lead to thoughts and even attempts at suicide.
I've never had any feeling telling me to hurt someone else. It's always been to hurt myself, if anything.
My suicidal urges are quite deep and quite profound. I want to kill me more than kill somebody else.
I agree with you because over the years I think I tried to attempt suicide 16, 17 times.
Yeah.
Man, if that didn't just break your heart, hearing another human being, multiple human beings say that, I just don't know what will. But thank God, people with this diagnosis can and they do recover. People are able to get back, health and have stable jobs and have relationships and just reconnect with themselves again. But unfortunately, not everybody does. Some have poor outcomes, and let's talk about why. The first is that having a lot of those negative symptoms that we just talked about is a poorer indicator of, future outcomes. And women don't usually have as strong of those negative symptoms, and so unfortunately that means that men in this regard would have poorer outcomes. And other factors are also earlier onset of symptoms, so the younger that you get it, which again, like we talked about earlier, that would be men. The next, though, can affect men and women, which is known as expressed emotions, so high level of expressed emotions. So what that is that family and or caregivers of a person with schizophrenia can just express their feelings towards them. So often expressing hostility or being overly emotionally involved. This is shown to result in poorer outcomes. And then lastly, which with the state of our country, I'm in the US. When I say our country, the state of our country right now, this is probably no shock. But people who are in developed countries have much worse outcomes than people who are in developing countries. And I didn't switch that. So people in the US, for instance, Americans, have worse outcomes than people in, say, Brazil or India. You might wonder, well, why is this? Because for a lot of other things, people in developing countries have much worse outcome than people in developed countries. Well, one of the reasons is that psychotic symptoms might not be seen or often aren't seen as negatively in developing countries. They can be tied sometimes pretty closely to some kind of cultural or religious aspect. So people with these psychotic symptoms, people might see them as being able to have access to the ancestors or seeing into a different realm than they can. And so seeing it in a positive light, that tends to reduce the stigma and can reduce people treating them poorly. People in developing countries also have more family members and they're less individualistic. It's more about the family. And so people with schizophrenia often aren't just left to, fend for themselves and figure it out. They're also in developing countries more likely to be married based on getting married maybe younger or arranged marriages. And like we talked about, that can be a great source of support. Also, we are just overstimulated in developed countries. There is so much going on all the time. And imagine for somebody with schizophrenia where their brain and they have these symptoms where they're already so overstimulated, where these voices are potentially yelling at them throughout the day. So to be able to go to a place that's calm and more peaceful and just detach can really help with that healing. And then lastly, having a mental illness isn't really a big part of people's identities in developing countries like it is in developed countries. I mean, this can definitely help with lessening stigma, it being an aspect of somebody's identity, but then when you have a mental disorder that's considered unacceptable or considered strange or considered scary or dangerous, then that just makes things worse. So what are we to do? Likely, a lot of you watching this are not mental health professionals, mental health providers, and maybe you felt incredibly powerless when it comes to maybe people that you know, or even yourself in terms of treating and managing some of these symptoms. So how can you help and how can you get them help? One of the things that you can do is absolutely under no circumstances challenge the delusions and the hallucinations. Like I said, and a big aspect of these symptoms is that people believe that they are real. And so when you are arguing against them that this isn't real, effectively it feels like you're gaslighting them. And whenever we are gaslit, we don't like that experience. We get mad, we get agitated, we get upset, we might get confused, we might feel like we lose trust in you because now you're gaslighting me over this experience that I have. So how can I trust you as a person? And then, of course, that's going to raise some hostility and go back to that high emotions that I talked about, the expressed emotions. So now you can easily get caught in that cycle, which often happens for families when they try to challenge these delusions and hallucinations. So I know it can be tough. I know it can be tough. And don't get down on yourself if you have tried to do this. It is very, very normal. What I would encourage instead is trying to interrupt these psychotic processes. So when you notice that somebody that you know, emphasis on someone you know, is maybe spiraling into a psychotic episodes with delusions or hallucinations, trying to interrupt that process. So it could be interrupting with physical cues. So maybe you tap them on the shoulder. It could be interrupting with kind of taking their mind off of it. So maybe you ask them a question about something that they enjoy. You redirect them to a pleasurable activity, but interrupting their thoughts when it comes to these delusions, hallucinations. What you can also do is direct them to us, the professionals. Please, please, please direct them to us. Now, there are different forms of treatment. I'm a psychologist, so I would talk about more of the therapy treatments, and these do exist for folks with schizophrenia. As I say that, especially if you're in therapy yourself, you might be wondering, well, how can a person that's out of touch with reality do classic talk therapy like what I'm doing? That's a good thought because they typically can't. So the therapy does look a bit different. So it might focus on doing those things like getting you to do everyday tasks. How can we get you to brush your teeth and engage in hygiene? So in a sense, kind of similar to some of the things we might do for people in, say, like a severe depression. but how can we get you to do more of these things? And then also teaching how to interrupt some of these psychotic processes. There's some other things that you would do to kind of tweak these sessions, but just know that therapy is available for folks. And then I would highly, highly, highly recommend, not even recommending, I'm begging, please, 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 as best as you can, get this person connected with a psychiatrist, with a medication provider.
It'd be nice if I could just go, oh, well, let's just pretend I'm fine and I won't take medication anymore and I will be fine. I'll be like anyone else. I don't have that choice.
Every day I take my medication, and without it, in all likelihood, I would be psychotic. I would be in not a good mental space.
Now, this is an area that I can't speak to in depth. I'm not going to talk with you about the different mechanisms when it comes to the medications. I'll link some pages for some psychiatrists below. As a psychologist, I did not go to med school. I am not a medical provider. I ethically and just with my expertise, and so legally, cannot provide you specifics about this. Of course, I took courses in grad school about different medications, so I know different classes, things like antipsychotics that can be very helpful, but I cannot speak to this in depth. But what I will say is that going back to the beginning when we talked about brain abnormalities, right? When you think about that, if your brain is abnormal, there is nothing that you can do to really change it, right? If the dopamine system is abnormal, you're not going to get the regular level of dopamine that you need without introducing something that can help you get that. So really that's what the medications are about. It's helping to, if you are having excess levels of dopamine just by nature, this can help with suppressing that. Same with ADHD. There's probably a good bit of you watching this that are diagnosed with ADHD yourselves, and with that, often what I see is these folks could either drink a lot of coffee, and then in my line, working with people with substance use disorders, normally their substance of choice might be some kind of stimulant, so cocaine, amphetamine. And then when I chat with them about it, they say, yeah, it feels like I can focus more, I can concentrate more after I've taken some cocaine, which I believe, because those things are stimulant, and the brain, that's what it's lacking, right? And so introducing something in the system, like caffeine, which is a stimulant, or a drug that's a stimulant, can get the brain what it's lacking, which is the idea behind what the actual pharmaceutical, actual professional drugs, I guess I shouldn't call them drugs, medications, medications seek to do too, without all the extra stuff that drugs have in them. So just know, I know there can be a lot of negative perceptions when it comes to the medications, but for certain diagnoses, it's vital, because the brain is just not set up in the way where a person can succeed a lot of the times. They need that additional help. All right, folks, I know I just took you through a huge crash course on schizophrenia, and no, I won't do that. I was going to recommend that you can, just skip your college class on the schizophrenia portion that's coming up, but I will not be telling you to skip classes. And so let me know again, like I said in the comments, how you found this video, if you want me to talk more in depth about other mental health disorders. But like I said, if you got to this point, I just hope that you can kind of look at this diagnosis and people that experience this diagnosis in a different light, maybe with a little more compassion. And if so, I'd love to hear how this video might have changed things for you.
Just because you have a schizophrenia or bipolar or anything, look at the person, not the illness.